For those of you who have watched my basic hip mobility exercise for pelvic floor dysfunction, this is a more advanced hip mobility exercise for weak pelvic floor and pelvic floor dysfunction in general. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. I've done a video on a basic movement of hips and explained in that video why that is even important. So I'm not going to go over that again here. Make sure you watch that. We're going to make sure we put at the end of this video so you get a chance to take a look. A more advanced hip mobility exercise is the 90-90. You may have heard about it, only I've seen it done wrong so many times. So 90-90 refers to the 90 degree here and 90 degree here. And you're sitting your rectangle, again, if you watch that video, you'll notice what I'm talking about. That rectangle, the top and the bottom are parallel to each other. And what we're doing is we're actually utilizing our feet to secure our position because we're going to be going to the other side. The key here is in this position, it's a little bit more difficult than the more of a basic one. Everything's going to move together and together like so. So you're not using one leg to pull this corner and then drag with it to the other side. It's huge. I've noticed a lot of people make recommendations, but they don't really pay attention to functional movement. So when you're watching these videos, pay close attention to the requirements it takes to do the movement functionally versus dysfunctionally. I'm very disappointed at the level of attention that is given to our movements and our breaths when it comes to pelvic floor weakness and pelvic floor dysfunction. So make sure that that is not your story. If you have any questions, make sure you use one of the methods of contact in the description box. And if you need to make an appointment to come in and see where you stand, what your story is, and where your dysfunction is, make sure you contact me. If you have not subscribed to the channel, do so now. And until next time, take care.